But for me, anytime I attend anything, a webinar, a seminar, anything, I always want to ask myself at the end of the program, did I learn something new? One new thing. I always like to challenge myself that way. So after the first session, I said, oh, okay, I learned something that I didn't know before. And one of the things I learned, which I didn't know. So like if a patient is on more than 2 medications and the seizures are not being controlled, the patient has to have another approach. One of the approaches including possibility of assessment for surgical management, right? And this has never been discussed with the family at all. So I said, this is what I learned. It doesn't mean your child is going to be 100%. It doesn't mean that your child is going to stop having seizures, but an assessment is required. Oh, that is what I learned from my attendance. So ask your neurologist whether they think it's worth referring the child to the program. The team at SICKIS to see whether that child needs an assessment for surgery. And like I said, that's how I framed it to the mother. So she said, okay, I'm going to ask. And I kind of felt very good about that, So I said, okay, well, let's see what happens. I'm not sure what is going to happen, but at least, it's being put on the table. It's out in the open, and hopefully something will come out of it, And I must say that this is something that I didn't know, until I participated in the program. So that's what I mean, having attended the program, I learned something, and I said, if it's just one new thing that I learned from the program and it's going to benefit one patient, I feel it's worth it.